everyone, and welcome. Hi, Angela. Thank you so much for joining me today.
Hi, Annie. This is a surprise. This is Megan's ill.
Yes, so Megan was supposed to host this interview, and she has tick bite fever. So that is never a fun thing to go through, and she's basically just down and in bed at the moment. But hopefully she'll be feeling better in the next few days. Guys, it is amazing to have so many of you online with us. I see all the numbers popping up on the screen. That's amazing. I'd love to know who is with us. So if you could let us know in the comments who you are, where you're from, and any questions that you guys have for today's topic. So we're going to be chatting today about hydrotherapy, and we're specifically going to be talking about the underwater treadmill and why there seems to be a bit of an obsession with it when it might not always be the best hydrotherapy modality for a specific patient. And that could be coming from quite a few different areas. So let's jump into that conversation. I do want to invite you guys all, please ask questions. Susan, it's great to have you with us. Hi. And then a big thank you to our sponsor for today. So CRI, the Canine Rehabilitation Institute, has sponsored this webinar. They're one of our summit sponsors. This year we spoke about the ethical dilemmas that we're faced with in rehabilitation. And potentially this conversation does fall into that category a little bit, because there are some areas where we become a little bit ethically gray when we're choosing the underwater treadmill over a different modality, but we're going to get into all of that. So Angela, thank you so much for joining us here today from Greyfriars. It is amazing to have you back with Online Pet Health. It has been far too long. So please introduce yourself and let us know what your interest is in today's underwater treadmill obsession topic.
Okay, so I'm Angela Griffiths. I'm a certified canine rehabilitation practitioner. Qualified in 2005, which I guess makes me senior in some ways, certainly very experienced. My principal interest is training. I don't do so much clinical work now. So I run training courses both at Greyfriars UK and then worldwide, so Canada, Cape Town next year. No, this year, November, and Singapore, usually once or twice a year as well. So I get to see different attitudes, different uses of treadmill, different machinery as well, and what's suitable and not suitable for some of our patients. So, and training, I think, keeps you on your toes. You're always having to, sort of reinvent and explain why you do it this way, not that way, and have those discussions, which are just really useful for clinical reasoning. So that's where I'm coming from. I just feel when I'm training people, there's a huge bias towards using the water treadmill, almost as though it's the senior, option or treatment option over pool, which drives me nuts, if I'm honest. I don't really care which we use as long as it's appropriate for the patient. And I do absolutely love treadmill for all those spinal injury patients that we've rehabbed with it, and lots of others as well. But, the spinal rehab is the real power of the treadmill. But it's got to be good quality and it's got to be appropriate for the patient.
I love that. Thank you. Angela, when is the last time that you were in South Africa? Because I remember, I think you ran a course together with the very first SAPRA conference that we held here, and that was the first one that you.
I've been 4 or 5, possibly even 6 times, and I work principally with Lauren Barham from Pet Wellness Works, but this time in November we're going to be with Dr. Tanya Grantham at her centre, or her new centre in Cape Town. But it was traumatic, my last trip, because COVID happened in the 2 weeks I was with you. UK shut down, South Africa was shutting down. We were quarantined practically in our flat. Beautiful view of the beach, but couldn't use it. And we got the second to last plane out, and luckily we had our flights booked to leave. And I shut down my business while I was there, 3 nights working overnight, and came back to complete shutdown for the next 6 months. So it's still traumatic in my head. And I think we got a cup of water and a cheese roll That was it on BA. And yet do you know what? People thanked the air crew and actually cried because they had all volunteered to get us out, really. So we were you're lucky I wasn't still there for another 2 years.
Wow, that's amazing. Hi, Meg. It's good to have you with us. Andrea, Robin, Sally, Heather, Emily, Bex, Susan, guys, it's so good to have you all with us. It's yeah, this is going to definitely be an interesting conversation. Okay, so let's chat about why there seems to be an overuse of the underwater treadmill. Like, what are some of the reasons behind that? So you mentioned now that there seems to be a predisposition in new graduates to be using the underwater treadmill. Can you go into that a little bit more?
Yeah, I train a lot of newly qualified vet physios, so they're coming straight out, they've just got their degree. And when they come on our hydro training course, which is mixed treadmill and pull, very much all the answers they give, all the explanations they give are really treadmill biased, that is the treatment option. And that comes from having been taught you must have control over movement, stabilize the spine, all of those things, but they transfer it to every treatment for every dog. That, you know, even when they do their assignments, they will always give me the treadmill answer, and I'll have to go back and go, what about the pull? You know, if you were doing this for this dog, how would you do it in the pull? So partly that may be because of the people training them, that's their experience. You know, how you were trained is how you train other people. Partly because that's the equipment very often at the university. Some of them have got pools, they tend to be small pools, so their experience of hydro in a pool isn't necessarily as good as it can be in some of the sort of medium or bigger size pools. So they don't really realize how powerful that option can be and how controlled it can be with very experienced hydrotherapists as well. You know, and I don't distinguish between one treatment or the other is better. It's what is appropriate for that patient at that, and it might be at that time, or it may be further down the line, you know, or maybe we need to do both. But it does feel like that. A lot of our referrals as well will come from the vets and they will specify treadmill only. Again, they don't have experience of pull. They, you know, it's a bit like when you get a referral for physio and they say you can assess the dog but you can't do anything with the dog. You know, those kind of referrals, you mustn't touch it, because they think physio is just swinging arms around and you know, range of motion. So it's like, look but don't touch. And it's a little bit from that with the vets as well. When they go to conference, what do they see? They see treadmills for sale, they hear the salesman, they get the lectures, the sponsorship comes from them. You don't really get sponsorship from swimming pool manufacturers so much, and a lot of the pools are self-built, self-designed. So there's all of that, you know, and they're told it's controlled. This is controversial, I shouldn't say it, but I'm going to. Guys like machinery, don't they? They like, you know, a lot of these orthopedic vets, they love it. And, you know, on the treadmill, you can measure exactly how far did the dog walk, what speed, all of that stuff. All useful, can't be quite as accurate with a pull, but does it actually matter, you know? And so that we get a lot of that. I've had many referrals which are treadmill only, and we have to go back and say, actually, treadmill is not appropriate at this stage of healing or with this particular patient, either because their patella is luxating more in the treadmill than it is in the pool because of the range of movement you go through. Biceps tendonitis, dreadful one in the treadmill. Very often they'll just lock and they'll lift the shoulder to avoid flexion of the elbow. And if you look at the film of what they do, weight bearing in the treadmill, working against resistance, that's very different than what you can achieve with a controlled hydrotherapy session in the pool.
I love that. I find a lot, you know, from, so definitely from my perspective, that vet referral where vets are specifically asking for the treadmill, and it often also comes from owners because they're seeing I don't know, videos on social media, or the advertising that they're seeing is focused on the treadmill, and it looks like, you know, this novel, interesting, fancy thing that they must have for their dog. So let's chat a little bit about, like, when would the pool be better? When would the underwater would a treadmill be better for a particular patient? How do we kind of reason through that? I know that's a very broad question.
Well, I think we start, it is broad, but we'll try and deal with it. I think we start from, what are we trying to achieve? You know, what are our goals and aims with that hydrotherapy that they've been referred for? Are we talking about strengthening? Are we talking about strengthening in a certain plane? Remembering that the treadmill is only the protraction movement that is against resistance. Retraction is passive. So are you going to strengthen the glutes in the same way as you are when you're swimming? You know, that's a clear example where actually you might want to do both. If you've got a hip dysplasia dog, we would normally, because they're uncomfortable, start in the pool. You know, all things being equal and no other contraindications, get them more comfortable, get the range of motion, start to build some strength, and then we'll include the water treadmill. Whereas a lot of people go, no, you've got to go straight to the treadmill because we've got to control their movement. But very often they're quite uncomfortable with that extension of the hip and the way the treadmill takes it back. So I would rather get the patient more comfortable, stronger, and then we can really work specifically on gait in the treadmill, and then we'll do a combination of them. Another example would be, say, a geriatric dog, multi-joint OA. You know, they're having trouble walking on land, even with support, and now you put them in a treadmill, you take down the weight bearing a little bit, not as much as people think in the water treadmill, and then you add resistance. That's like taking your grandmother to the gym and asking her to walk with, you know, knee and feet and hip arthritis against resistance. You know, you wouldn't do it with an elderly human patient, and yet we expect these dogs, because they make it look easy in the treadmill, we expect them to do that. And the way I think about it, especially with the multi-joint OA falling dogs, is they're still taking significantly more weight on their forelimbs, and what the treadmill does is take away one of those limbs and forces them to weight bear for a length of time, however, depending on speed, etc., and higher water. So what we do is we force them to weight bear on painful limbs, and they can't not do it. It's like a hamster on a wheel, you know, whereas in the pool, if they've had enough, they'll just tuck up and go, I'm not moving, I'm not doing it, you know. So I don't like that compulsion aspect of it, and especially with inexperienced people who aren't seeing that the dog is actually struggling and that you're not getting good gait because the dog just can't do it. It's too difficult.
Those are really good examples, Angela. Like, I think of, you know, HD dogs, and if you're getting them into that space where they're going into too much retraction that they're not controlling, and then they have this like they're overdoing that protraction, but they're also ending up rotating the limb or creating compensatory movements in other ways, and you're then strengthening a poor alignment, a poor gait. Whereas in the pool, you're strengthening the retraction within their comfort space. And
it's not all in a sagittal plane, is it? You know, it's it's multi-movement. It's not, the dogs don't move in a sagittal plane, do they, on land, you know, especially the younger ones. So, yeah, and you're right. And what they do is they'll externally rotate the limb, or they'll move the hind limbs medial, and then they'll use lumbar side flexion to reduce the range of motion in the hip, as they do on land. But you can see it very clearly in the treadmill. If you look over the top, you can see, you know, as you go on and they start to struggle, you get more lumbar side flexion and the gait quality goes down. So as you say, Annie, we're not improving their gait, and we're using the wrong muscles, and we're strengthening those, aren't we? You know.
Yeah, and as an inexperienced practitioner, it can be hard to see those adaptations to the movement. So I think that's definitely something to think about. And when we're considering these joints that are inflamed and painful, really our first goal is to reduce their pain. And the pool is just so good for that. Even just having them floating, like just floating in the pool, great, unload those joints, and then we can start getting them moving without flaring them up. It's fantastic.
And then you've got the warm water, your flexibility of the muscles, their active range of motion increases. They're just much more comfortable, aren't they? Even if we just stand them in the water, you've got the warmth of the water, hydrostatic pressure, all of those things going on, all helping to normalize their pain response as well.
Mm-hmm.
And they're having fun. And I think we miss the fun bit out very often, don't we?
Yeah, so patient preference is a really big one for me as well. Is there are patients who, you know, they're if they're in the underwater treadmill, it's like they get they're either too excited and then they're not moving well, or they don't like it and they're uncomfortable. It's not every patient, but put them in the pool and they're a happy, different dog. And so, yeah. I mean, in those cases, even if the condition is indicating that the underwater treadmill is better, you could still have a better outcome in the pool because the patient is giving you better quality movement, and they're happier, more comfortable in that space. So, so really a case of like, there isn't one best modality. It depends on what your goals are, as you said, and then the individual patient. Okay, so let's chat about when the underwater treadmill would be better, because we're definitely not saying don't use the underwater treadmill. When would that be the better modality?
I think pretty well all spinal patients, and that's a with a caveat on that. All I think when you have a spinal injury patient and spinal stability is crucial, then you're going to be heading to treadmill. And then my head's going while I'm saying that, except for those spondylosis multi-joint OA dogs, where actually we might want to just do straight lines in the pool. But you know, it's so powerful if you can stabilize the spine. We're trying to replicate gait. We're trying to use, you know, central pattern generators to generate hind limb gait. That's when the treadmill is absolutely powerful. And when the patient needs a lot of support, and you know, some of the problems with using the water treadmill is that there's not enough practitioners at the center to do it well, you know. And I see so many videos which you're talking about, clients, owners seeing, where they just see a dog on a lead walking really badly on a treadmill, and you know, and people often share bits of treadmill with me just to give me nightmares at night, saying, you know, I got this from the hydro center, look what they're doing with my patient, you know, and the dog's riding up and back on the belt, they're turning sideways, they're externally rotating, and you're just going, just stop, just don't do it at all, you know. But definitely spinal injury patients, some of those bigger dogs, if we can give them enough support, are great in the water treadmill. And lots of dogs do really like, amazingly, if you think about what we're asking them to do, they really like the treadmill, and the food helps and the toy helps. I've got dogs that bark at us to make it start, you know, they love doing it. So it's not every dog, is it? And they're surprisingly compliant, considering what we're doing, what we're asking them to do, without explaining to them. So I would say probably some of the orthopedic surgeries like TPLO, TTA, hip replacement, I'm going to be probably going to water treadmill if I possibly can, because we need to control their movement and we need to support their movement through weight bearing. So when weight bearing is an element of our rehab plan, then yes, we'll probably head to water treadmill. But again, we're going to have to be really careful that, for instance, if they've had a TPLO or cruciate repair, that we're not putting really vast sort of torsions through that stifle, that our water level is appropriate for the patient at that time of their recovery. For me, that means being hands-on. I don't see any point in putting those patients in the water treadmill and looking at them walk from outside, or you can't stabilize their position on the water treadmill and on the belt, and then you just let them walk badly. That negates the whole reason. What everyone's been taught is it should be controlled, and we need to sort of facilitate good gait, good weight bearing, sagittal plane. Well, if you're just going to do that, put the dog in on a harness or you know, not be hands-on, then you've just negated the whole point of going to the treadmill.
Yeah, that is an interesting one. Yes.
Doesn't it? You know, we've just gone treadmill because it's controlled, dump the dog in there, choose some kind of water level that kind of the dog can cope with, and then we ask it to walk. You wouldn't do that with a human that's just had, I've had medial ligament, I always say stifle about myself, but I have had medial ligament injury my knee from skiing, and it's 4 or 5 years now. I can't walk in the treadmill. I can run up and down the pool all day, but I can't walk in the treadmill because the strain on my knee because of instability is too much. And the same applies to those dogs, doesn't it? Now, if someone had their hands on my knee and supported me through that range of motion, I might be able to do it, But no one's volunteered yet, so.
So you haven't tested that out.
No, I've thought about it now. So I've got a treadmill course coming up on Thursday, Friday this week. So we're going to have a little play with that with some of our students. And another thing we do with our students, actually, slightly sideways, is I put the students in the water treadmill and make them walk. And we gait assess the students. And often they go, no injuries, I'm fine. And it's amazing how you can see little differences in how they're walking. You can hear their gait change. And you say, did you injure your right knee at some point? Have you got a hip problem? And they go, oh yeah, I forgot about it. And it shows in the treadmill because they're under strain. Same with the dogs.
Yeah. We often forget that added resistance that the water gives. And it's a big part of the underwater treadmill. It's a big reason why we want to use it. But if we're forgetting about that resistance in the early phases of healing or when there is joint instability, that's a really big one. So when you're stabilizing a joint like that, Angela, are you using your hand or do you use other tools like TheraBand or other ways of supporting the patients as well? What kind of support systems
tends to be pretty well. Our style is hands-on. We need to feel that joint. So say if they've had a TPLO, TTA, we'll be hands-on. We'll have our hand sort of cupping the tibial crest so that as they come through, I'm waving my hands about. It's hard to do without saying, but as the patient's limb is retracted, that's when they'll try to shorten their stride unless you provide support through that weight-bearing phase of the stride. Patella luxation, we can't prevent patella luxation, but if we're hands-on stifles, we can certainly feel it. And it's amazing, actually, how often spinal injury dogs, because they've lost muscle and strength, do luxate as well. And again, with the hips, you can feel if there's crepitus, so you're getting all that feedback. And obviously, if you're placing the hind limb paws, you need to be hands-on. You can't just leave the dog to struggle and hope that it, gets enough proprioception to help it, protract and then, sort of place without knuckling. You need to be hands-on. The whole point is for you to be giving proprioceptive input, aiding their protraction and retraction, and trying to replicate a good stride, a good length of stride. And you're trying to move towards better gait and walking, obviously, aren't you? And I would say with those patients, very often, another way of using the treadmill is don't move the bout at all with a smaller dog. With those spinal patients, quite often we'll start them without the treadmill bout moving. We'll encourage them end to end. And you can then get really good film of what can they do for themselves with the support of the water. So it takes away that weakness thing. But just always remember with the resistance, if the belt is moving, that resistance is only on the cranial surface of the limbs. There's no resistance to the body of the dog because they're not moving. It's just the limbs that are moving. If the belt is static and the dog's walking around the treadmill, then they're experiencing resistance in different planes as they would in the pool, So it's a very different thing. And I think it's underused, to be honest, and especially for gait assessment, because you're doing with the water what you would be doing with say a hindquarter harness or chest harness, where you're unloading them and allowing them the opportunity to move and get good gait because you've raised the pelvis level, and you're doing the same with the water. And it may take your hands as well, sort of ventral pelvic lift and someone placing on the paws. And I can hear people, I'm sure we're going to get some chat and questions coming in. It's like, what if there's only me? Well, I don't think you can do it really well if it's only you. You don't have to have everyone qualified, but you're the most important person. If you're the most experienced, you can teach other people how to do the placing, the handling, etc. But you need to be observing gait and movement. You're the person, you're the physio that can see, or the experienced hydrotherapist that can see that movement and assess it, and then you can make changes based on what you're seeing. But we've got away from why don't we do treadmill here, haven't we? I've just been talking for 15 minutes about how it's great, but it's great if you do it really well.
Yeah. Okay, no, I really like that. And I think that's an opinion that's worth exploring, right? That if you're alone, can you truly use the underwater treadmill well, or are you using it at a cost of quality? So I think that's really an important thing for us to think about when we're using this modality and when we're planning our practices if we're solo practitioners. Gail, thank you for your comment. I can confirm this is true, you say. So we were talking about the joint instability when that came through. So thank you for sharing that. That's really interesting. I actually haven't done that kind of test myself before, but I'm sure it would be very revealing to walk on the underwater treadmill. So from our listeners, I would love putting students on the treadmill. Very interesting. And then seeing those adaptations to their gait. I love that. So from our listeners, I'd love to
tell you what we also do, Annie. We run them for 5 minutes because, again, I think people put dogs on for too long, or their sessions are too long, because it's like repetitions at the gym. And so I run them up. I don't want to break them, obviously, and I ask, do you have any health issues? But they walk for 5 minutes and they are exhausted, they are struggling, and then you say, are you going to do that to a dog? Never. They'll do 30 seconds, a minute, 2 minutes, 3 minutes, but they understand in a way that you can't get with a lecture, what it feels like to do that, and 5 minutes is a long time on the treadmill.
We really need to do that with every single modality that we use. Like, have you done that to yourself? Do you know what it feels like? I think it's so important. And we don't always. We sometimes just get into this thing where we're doing, and even if we've been working for many years, sometimes it's worth just reminding yourself by applying that modality or whatever to yourself and checking in with yourself. So I think that's a really important thing to remember and to check back in on. I'd love to hear from you guys, from our audience. So our topic today is why the obsession with the underwater treadmill. I'd love to hear if you agree with that. Is there a bias towards the underwater treadmill? Is that something that is kind of regional? It's not necessarily everywhere, because that definitely could be true. And if there is a bias towards the underwater treadmill, where is that coming from your experience? Is it new graduates, like Angela's experience is kind of bringing up? Or is it from veterinary referrals where they're biased towards the underwater treadmill? They're specifically asking for that? Or are the owners specifically asking for that? Because I would love to get a better sense of that. Sometimes we get this idea in our heads that, this is happening within our industry, but it's not necessarily a widespread thing. So
I think I can add to that my experience, we were at a centre in Costa Mesa, and the owners, so it's vet run, and there's a whole big team there, and the owners asked me to do a talk to explain to their vets why they should be using the pool as well, because the vets just wouldn't refer, even in-house, to experienced people they could talk to. And you can do the handover and say, I don't want the dog doing this, or I need this kind of movement or whatever. But so I had to do a talk to the vets to explain why pool had a place in rehab. And I've got the same. I'm going to Houston Sunday, this week. And again, could I talk to people that are referring to the centre and explain why pool is equally valid? Where I find the bias goes is when the referral specialist or the referring vet physio understands the experience of the team and has confidence in you and your ability to clinically reason the treatment and give them that feedback about why you went one way or the other. So we tend to say, actually the referral is for canine hydrotherapy, or it might be physio, and we will decide what is most appropriate, because most of the people making these referrals have no training, none in hydrotherapy. They don't even know what happens. They just think dogs swim and chase balls, you know. And so the person advising you how you should do your job has no experience or anything to base that, you know, that instruction on, which clearly drives me nuts. And lots of other people. It's no different in Canada. I've seen it in USA. Singapore, not so much actually. Cape Town, definitely. You know, so it's worldwide. In my experience, you know.
It's very interesting. I think that your earlier comment about the men that like the gadgets, I think it's not. I mean, it's not just.
I'm going to get slated. I'm going to be so much trouble for that.
Boys and their toys. No, I think we.
Well, that's the.
That's
a lot of the ortho surgeons. There's a lot more guys doing that. I find the neurologists are much more switched on, and it's a bit more of a mix. But then you've got a lot of very good women neurologists, haven't you, as well? So, because it's, you know, it's hard to do, and they choose it. So, I think we just have to move on now.
I love this. Heather, thank you. I've been hearing a lot that vet physiotherapists are very underwater treadmill biased, and that is changing the industry perception. So that's really interesting. Heather, are you in the, where are you in the world? Are you in the UK or somewhere else? I'd love to know. And then, do you know her, Angela?
It's UK, yeah. She's a past student a few years ago.
Awesome. Oh, that's awesome. Andrea, thank you for your comment. I certainly think there is an obsession here in Costa. I believe it's very much related to cost. It's a very expensive machine, so it must be the best thing ever. Also, from the perspective of the person making the investment, yes, they have to recover that money, so they charge separately for these sessions.
So then that really will push them. Yeah. It will push them to use the treadmill back to back. We need to fill the treadmill. We need to use it. And then you've got the problem of, but it takes more people too. So now that makes it more expensive. Can we even charge what it's costing to provide that service?
And it does also create this this kind of like production line, right, feeling with the underwater treadmill, which is something that I've seen quite a bit, where it just feels like you're just pushing patients through the treadmill all the time. And really, if that's the case, then again, I want to say, like, how much is the quality of the treatment suffering in that case? So I think that's important to think about.
And I know a lot of people do film sessions, but I think if you can film a lot, and, you know, both sides and front and back, and look at that gait and really assess that gait, which we do on the courses. We do a gait assessment outside. We film the treadmill session, multiple goes, and then we film gait after, and then we go back to the classroom and look at that and slow-mo it and really look at how different was their gait in the treadmill to on land. Was it an improvement, or are we just breaking this dog? Or, you know, with some of the neuro dogs, you take them from the treadmill, put them back on land, and they do really well, even though they're tired after the treadmill. Their proprioception and their movement is still better after treadmill. But then the question is carryover. So I think for those of you that are perhaps, you know, I don't want to suggest people aren't trying to do a good job. I'm just saying we need to look, like you say, Annie, really closely at what are we doing and why. And I think if you can film more, certainly one of the centres I go to at Hong Kong, they've got Guinness, who is the gadget master there, and she's got cameras on everything all round. But it's fabulous because the girls in the treadmill and the guy, they can look at those cameras live while they're doing what they're doing as well. So they kind of make up for, say, one less person by having those cameras. So they're really useful. But there's no substitute for both how it feels and how it really looks.
Yeah, that's a good idea. I like that. Claire, thank you for this. I think the explosion of dog fun swimming sessions, setting up as hydrotherapy centers by unqualified people, have a lot to do with it. So I think that's a really good point, right? So swimming then starts to look like more of an unprofessional, fun thing, whereas the underwater treadmill has this professional look to it. And then, thank you.
Yeah, and I think actually, certainly in the UK, I feel we've gone backwards a bit with that, and that what's happening is that, you know, that's money pressure. It's post-COVID. A lot of good centres have closed down, and some people are just getting to the age where they're starting to retire now. The original people who are really experienced are leaving the industry. And yeah, I agree with that. It's not a good look if you look at the films that are shared on Instagram. You know, it's more Instagrammable, isn't it? Dog having fun in the pool, and you know, and I post those pictures. We had cute puppies in at the weekend, their first swim, you know. So everyone does it because they make great pictures, you know, and it's not so, well, I still get cute pictures in the treadmill as well, but it's that look. And I agree, it's that unprofessional look about it, or that unprofessional perception from the vets about it as well. It doesn't help.
Thank you for sharing that, Claire. I appreciate it. Emily, I find having a smaller pool can be limiting, especially with the constant turning. So that's another really good point, is sometimes we have only an underwater treadmill. Sometimes we have the underwater treadmill in a really small swimming pool, in which case how much, you know, then the way that we're using the pool is completely different as well. So let's chat a little bit about that. And
I agree with Emily. I agree. If you're having to do lots of turns, then clinically reason you're going to be perhaps pushed towards a treadmill because the quality of what you can do is better for those particular patients that you're trying to avoid that with.
Thank you, Emily. So let's chat about how we can handle the situation when a vet or an owner specifically asks for the underwater treadmill and we don't think that it's appropriate for that patient. How do we address that?
Well, sometimes I'll speak to the vet personally. I have had situations where I'll film the movement and say, look, we really don't want this for this patient, or we'll try because we've been pushed to it, because you don't want to be in a position where you're completely refusing, though there are occasions when we do that. And I'll share it. You can write a report, describe movement, blah, 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 all of it. If you send them a film clip saying this dog is not, you know, for instance, flexing its elbow because his biceps tendon is too sore, it doesn't want to do that, and therefore we can't achieve the rehab aims or goals, then they'll watch that and go, oh, I get it, you know. And especially if I cheated and I did some film in the water and said, this is what we want. So that works. I wouldn't say we get that much pressure from the owners or clients about water treadmill and asking for it. If anything, the pressure goes the other way because they want their dog to have fun and swim because they love swimming. So the pressure is definitely from the referring professionals, whoever they are, not so much the owners. And often we'll have owners that for 10 sessions in a row just keep saying, while we're in the treadmill, when can they go to the pool? When can they go to the pool? You know, and sometimes the answer is never with your dog. Is your dog going to the, you know, because of behavior, craziness in the pool, or because it's not, you know, condition appropriate.
Okay. Thank you, Angela. Is there a never for the underwater treadmill? So which patients would we never put into the underwater treadmill?
I would say any amputee, because you know, and quite often my students will say, oh, because you're putting a lot of strain on the other limb, blah, blah, blah. It isn't. It's because the treadmill belt movement takes the limb they need to stand on away. You know, just imagine that if you have an amputation and you're on one leg, why would you go on a water treadmill? You might walk in water, you know. So because what would be the point of putting the amputee in the treadmill? It would be to get good gait. You cannot get good gait in the water treadmill with an amputee. You can get great gait in the pool with an amputee, and I would say non-weight bearing as well. So quite often people will say, let's put them in the treadmill. That will make them weight bear. That will make them put weight through that limb. But if the reason they're not using the limb is pain, you've just created that same situation I was talking about with elbow OA geriatric dogs. Again, you're achieving your weight bearing while you're looking at it in the water treadmill, but at what cost? You know, the dog will use the limb when you've created the right conditions for them to use it. And pretty well, that will be that pain is under control. So we have this a lot with femoral head osteotomy dogs, so leg calf Purse disease, etc. And I won't put them in a treadmill until they're pretty well walking, you know, and good toe touching reliably. And then we can work on gait. First, I need to avoid contracture, and I need to get them using those hind limbs. And again, I'm not going to be putting a lot of input into them in the pool. I'm going to be suggesting they use them, but you don't want them really kicking hard straight away, because you just, you know, the reason they're referred is they're not using the limb, they're holding it flexed, and then you're going to make them more painful. So you've got to sort of lengthen that recovery time. So it's getting, you know, the pain under control. And often Rimadyl or Metacam is nowhere near enough. They need gabapentin as well. They even need Pardel, something like that. Once we're on top of the pain, they use the limb, then we go to treadmill, you know. So any non-weight bearing dog, I'm not going to force it to weight bear.
Yeah. I really love that, actually, because, you know, if you're the treadmill doesn't help you get weight bearing if you have a non-weight bearing limb, but you can do it through land-based exercises, and the swimming pool helps, right? Because they only move within a range that they're comfortable in the pool, and you can help them further with your hand on the leg, whatever, but within that comfortable space. So I think that's really good to remember.
And you can do standing exercises with the benefit of water in the pool, on a platform, on the ramp, but you can use the treadmill the same way. If you don't have a pool, you can still use the treadmill tank as a pool for the smaller dogs. So I would do work with them standing in there. I'm just not going to start the belt and take away their other limb, because they'll either put the surgical limb down because they have no choice, or they won't because it's painful, and then you're not going to get good gait anyway. So but I don't mind putting them in the water treadmill, high water, using that, all the benefits of that. Just don't start the belt, you know. And you can be hands-on, assisting them, giving them confidence, you know, massaging, getting them to drop the limb down and be more comfortable, and maybe take 2 or 3 steps, and gradually that'll increase. So you can do that in the treadmill. Just don't start the belt, you know.
I must say, I find the amputees conversation so interesting, because I don't have a lot of experience with them. But when this conversation first came up, I was like, but the underwater treadmill makes so much sense, because we're trying to teach them to, we're trying to retrain a new gait, right? They don't know how to walk on 3 legs. We're trying to teach them that. But then seeing them, it's like, oh, wait, it doesn't work like that. It isn't the reality. And in the same way, you're thinking, well, I don't want them in the pool because they're missing a limb, which means there will be some rotation or imbalance. And then you might not have as stable a dog in the swimming pool with only 3 legs. So actually, how do you...
in a life jacket, hands-on, so say it's hind limb, life jacket, because we don't want them to roll over. Obviously, if they dip towards the side where there's an amputation, if it's a forelimb, they can't come upright. So you need to have additional flotation that side. You need to be hands-on and beside them. And then you probably have someone else with you stabilizing pelvis as well. I'm in the fortunate or unfortunate position of having had 3 amputee, 1 cat and 2 dogs with amputations. And I didn't I amputated the cat because he had cancer, osteosarcoma, really young, and then a rescue who'd had a really badly fractured, so it was a greyhound, badly fractured forelimb. Owners didn't take it back to have the plaster cast take off. It was a mess. So that, and I also have a little Poppy, my German Shepherd, has a paw missing, or she kind of got the metacarpal pad, but that's it. And I did put her in the treadmill to prove you can't do it with a dog like that. And she just went, I got this. And she's really good and does it on the courses. But her limb is just long enough that she can do it. But you're right, we're trying to replicate their gait. And if you look how a amputee, say forelimb amputee moves, they drop really low and do almost double steps with the forelimb because they have to cope. Hind limb not so bad, but what they do really do is load the other limb. They'll bring it medially, and you need to strengthen that, and we can strengthen that so much better in the pool. We just need to make sure they're safe and they're stable and assist that gait in the pool. Sarah Shannon, who's, I think she's head of anatomy now at the Royal Vet College, look her up because she did some amazing work on the biomechanics of both amputees, and she did a lecture. I went, that was great. If you've got anything else? And she said, oh, I did the biomechanics of swimming. And I think she did a lecture for Online Pet Health as well. It's like, this crazy woman knows this stuff, you know, and really gets it because she's done the science behind it. She's looked at the range of motion of all the joints in the pool. And when the dogs are in the pool, they're in a normal anatomical position for walking and going through very similar range of motion in all of the joints. When they're in the treadmill, they're shortening their stride, they're changing things to cope, you know, and I'm not saying it's wrong, it's just that's what happens, and we can facilitate them. But for them to do a longer stride and be more comfortable, we have to stabilize them. And to do that, you're probably going to have someone stabilizing the limbs, providing support and stabilizing the dog, like holding a child's hand when they're a bit wobbly on the bike. You're stabilizing the dog so that they're confident to take those steps and make those longer strides. Otherwise, they're just going to shorten up.
Okay, amazing. Thank you so much, Angela. Guys, if you have any more questions, please share them with us. We can come back and check the comments as well when we finish this live. If you're watching as a recording, the same, please feel free to ask questions or leave your thoughts and comments. We'd love to hear from you. Angela, where can people learn more from you and from Greyfriars?
They can go to greyfriarsinternational.com. That's our overseas training website, or greyfriarsrehab.co.uk for UK courses. They can then see what we're running, or they could just email me, angela@greyfriarsinternational.com, and I'll come straight back to you. I just wanted to cover one more thing. Have I got 30 seconds? Obesity.
Yes, you do.
Put the dogs. Obesity. Put the dogs in the pool because they're doing more cardiovascular work and they're swimming for longer and they're doing more. I can't handle obesity in a treadmill. The dogs don't do enough, you know, because you do it 30 seconds a minute, 2 minutes. If you've got an obese dog, it's not going to treadmill in my world. You know, we're going to go to pool every time, unless it's spinal, and then it all gets really complicated.
When it gets complicated. Okay, thank you. Heather, yes, this is being recorded and it will be on Facebook, so you can rewatch it anytime. So yeah, no problem. Angela, you have some courses coming up now, and we're going to have you back in South Africa. Can you tell us about that upcoming course in South Africa, which is right after the IAVRP?
Yeah, that's it. So IAVRPT conference finishes on the Saturday evening, which I make that the 2nd. And then on the Monday, Tuesday, Wednesday following that, so we can all have Sunday off and have a drink, get some sunshine, something like that. So Monday the 4th, Tuesday the 5th, and Wednesday the 6th, we have an advanced continuing education course. So it echoes what we do on our level 4 advanced course in the UK. So a day of gait and 2 days of applied treadmill, because we need to make sure we're watching, describing, and able to use the right words and work as a team on gait, and then we transfer that to the treadmill, which is the whole point, isn't it? Can we get good gait? Are we achieving it? So I'm really excited about that. And we're working with Dr. Tanya Grantham for the first time, who I know is an Online Pet Health favourite. So she's kindly made her facility available, and we're all, and Lauren Barham's still going to be there as well. So we're all really excited about the new course, the new way of working, and how we provide that step up, that extra bit of education. So be brave, come and join us. You know, it's on the website, but you can email as well, and it's on our Facebook too.
Okay, thank you so much. Emily asks, will you be doing level 4 hydro massage course again soon?
Yes. In the UK, and pass on the dates. I think it'll be springtime now, knowing what's coming up in the next couple of months. I think it'll be springtime sometime. So maybe towards March or April, something like that.
Awesome. Fantastic. So guys, if you are coming to the IAVRPT conference at the end of the month, it's around the corner. We're very excited at Online Pet Health. You're going to see us there. We're going to get to see all your faces. It's going to be amazing.
Great. Yeah.
But it's a really great time to stick around in Cape Town and join Greyfriars for their course. I think that's going to be really great. Thank you.
That's great. Yeah, I'm looking forward to seeing everyone again.
It's going to be good. It's going to be so good. So if you guys want to continue the conversation, I'm actually going to be live tomorrow with Tanya Grantham, and we're going to be talking about the ethical considerations in mobility cart use. So that stream is also going to be on Facebook. And in a few weeks, I'm going to be chatting to Carleen about amputees. So she's got 3 of her own amputees, and she's a vet rehabber, and has some really good thoughts and perspectives on how we can help them. So that's also going to be a really good one in the next few weeks. All right. Angela, thanks so much for joining us today.
Thank you.
Can't wait to see you.
All right. I'm looking forward to it. Thank you very much.
Bye, everyone.
Bye-bye. Bye, everyone. Send those questions in.
Yeah.